Outside of that, it feels really good. We're helping with blood perfusion, circulation, venous return, lymphatic flow. So there's lots of things that happen with manual therapy. So just because we're not fixing people per se, doesn't mean it's not powerful shit. I like to say manual therapy is optional, but it might be optimal in the sense that if you really want to accelerate your recovery, accelerate your healing, rehab injuries that are maybe old and really giving you trouble with range of motion, get on the table with a good hands-on therapist and it will be a fucking game changer, I'm telling you.
That's Mike Stella from the Movement Underground, one of my favorite people online. I've been on his podcast in the past. You guys will have to check that out. That point he makes about manual therapy might be optional, but it also might be optimal, could not be more true. And the way he talks about accelerating recovery, that's the big benefit, right? What I can do with manual therapy, I can do so much faster than it would take for me to teach a patient a self-administered technique, have them get good at that technique, practice that technique for a period of time to actually get the outcome I'm looking for. Let's say we're trying to increase something like dorsiflexion. It's going to take time to teach somebody how to release their calves, maybe self-administered mobilize their ankle, calf stretch, tibialis anterior activation. That might be half a session. Meanwhile, with manual therapy, I can actually do a better job because I'm more practiced at it, right? I've been doing this a while, and I can do it in literally minutes because I know what I'm doing. So I can get this big increase in dorsiflexion, get them all stabilized, get them feeling good, then teach them the self-administered technique to self-manage the problem on their own, but they benefit from that huge boost. And in case you guys are wondering about the research, because you know who you're talking to, the research says the same thing, right? The research shows that in the acute phase of an injury, manual therapy might be better than specific exercise. If you add manual therapy to an intervention plan, it improves both short-term and long-term outcomes. And as far as this weird myth that it's just transient neurological effects, that's garbage too. There is so much research to show mechanical effects from doing manual therapy. Everything from reducing stiffness in a joint to normalizing tone of overactive and underactive muscles, and I guess you could call that neurophysiological, but it obviously has a mechanical effect. All that's in the research. I will leave you guys some links below, and please follow my boy Mike Stella. He is an amazing clinician.